For over a century, the Mérieux family of lion has quietly shaped the way the world fights infectious disease, building a biomedical empire that gave rise to Sanofi Pasteur, bioMérieux, and a global network of diagnostic and humanitarian institutions. They are an entrepreneurial legacy. Founders who discovered and built innovations then passed them forward across 4 generations without acquiescing their scientific or business ambitions. Their story begins in Lyon in the 1890s with a young chemist named Marcel Mérieux. Born in 1870, Marcel studied at the École supérieure de chimie, physique électronique de Lyon before finding his way to Louis Pasteur. Pasteur's laboratory was, at the time, the center of a revolution. The germ theory of disease had only recently become mainstream, and Pasteur and his colleagues were actively developing the conceptual and practical foundations of vaccination. Marcel didn't just absorb theories there. He absorbed a way of thinking about science as something that must be translated into practical intervention at scale. He returned to Lyon carrying that conviction. In 1897, Marcel Mérieux founded the Institut Biologique Mérieux, a small analysis laboratory. From the outset, he was producing anti-tetanus sera, working with horses and cattle as biological production systems, and beginning to build what he envisioned as an industrial platform for biological medicine. The ambition was clear early. In 1917, Marcel moved his animal stock to a village west of Lyon, establishing the infrastructure that would define the company's geography for the rest of the century. He was laying a physical foundation, not just a scientific one. Marcel Mérieux had 2 sons. The elder, named Jean, was a physician who worked in the family laboratory. He died of tuberculosis-related meningitis at just 26 years old, contracted in the same laboratory where his father was developing tools to fight infectious disease. It was the first of what would become a sequence of tragedies in this family. The younger son, Charles, born in 1907, became the heir by circumstance and proved to be one of the most consequential figures in the family's history. Charles Mérieux was trained as a virologist and physician, and he took over the laboratory in 1937 following his father's death. What he inherited was a relatively modest operation, which would soon become globally significant. The key inflection point came in the 1940s, when Charles introduced a technique developed by Dutch Professor Frenkel, in vitro cell culture, which allowed vaccines to be manufactured without relying on live animal hosts. This wasn't just a scientific upgrade, it was an industrial one. It dramatically reduced production costs, increased scalability, and created a new category of biological product, reagents for in vitro diagnostic testing. Charles saw that the same biological expertise that made strengthened vaccines could be redirected into diagnostics, and he began moving in both directions simultaneously. By the 1960s, Institut Mérieux was a serious enterprise. Charles had forged a relationship with Rhône-Poulenc, the major French chemical and pharmaceutical conglomerate, which took a minority stake in the company. This partnership gave Mérieux access to capital, distribution infrastructure, and political leverage inside the French industrial establishment. It was a strategic trade-off that would define, and eventually constrain, the family's control over the vaccine business, but in the short term it enabled company expansion. The most dramatic demonstration of Charles's operating capability came in 1974, when a meningitis epidemic erupted in Brazil. Charles Mérieux's organization produced and delivered roughly 100 million doses, immunizing approximately 90 million people. The operation was extraordinary in its logistics and speed, and it transformed the company's revenue profile overnight. The company's turnover went from the equivalent of about 20 million francs to over 400 million in 3 years. Charles was also building relationships and influence beyond pure commerce. He collaborated with virologist Hilary Kaprowski on a safer rabies vaccine. He worked with the U.S. Centers for Disease Control to establish training infrastructure for epidemic response. He coined and popularized the concept of vaccinology, the idea that immunization should be understood not merely as a product, but as an integrated system of logistics, cold chain management, and public health delivery. That framing would give the company's work an institutional legitimacy that pure commercial vaccine makers couldn't easily replicate. In 1985, the family made what turned out to be a pivotal and ultimately irreversible strategic move. Under the influence of Rhône-Poulenc, Institut Mérieux became the majority shareholder of Institut Pasteur Production, the industrial vaccine subsidiary of the Pasteur Institute. 4 years later, in 1989, Charles orchestrated the acquisition of Connaught Laboratories in Canada, at the time the country's primary producer of vaccines for diseases like polio and diphtheria. Connaught brought North American manufacturing scale and regulatory standing. The combined entity, eventually named Pasteur Mérieux Connaught, became the world's largest vaccine producer. But the Rhône-Poulenc relationship was deepening in ways that were moving control away from the family. By 1993, when Rhône Poulenc was privatized as part of France's broader shift away from state-directed industry, Alain Mérieux, who had by then assumed leadership from his aging father, chose to exit the vaccine business. Rhône Poulenc bought out the family's stake. The animal health subsidiary, Rhône Mérieux, went the same way. Those entities would eventually become Sanofi Pasteur and Mérieux. The Mérieux family had built the world's largest vaccine company and then ceded it entirely. The decision to step back from vaccines can be considered a reorientation. While all of this was happening in the vaccine division, Alain Mérieux had been building something else in parallel. Alain, born in 1938, is Charles's son. He trained as a doctor of pharmacy and attended Harvard Business School. In 1963, he established bioMérieux, which focused exclusively on in vitro diagnostics. Alain took majority control of the business in 1974 and began building it into a serious enterprise. The strategy at bioMérieux was acquisition-led but focused. In 1987, the company acquired API Systems, a French maker of bacterial identification systems. In 1988, it acquired Videx Systems from McDonnell Douglas, an American company that had developed automated microbiology analysis tools. Under Alain's direction, the holding company also expanded into adjacent areas. Transgene, a company developing gene therapy-based approaches to cancer and infectious disease, was brought under the Institut Mérieux umbrella in 1994. Silica, an American food safety testing company, followed in 1998. The family was no longer just in vaccines. It was building a diversified life sciences holding company organized around the central theme of detecting and combating biological threats. In 2001, bioMérieux acquired Organ and Technica, expanding its immunoassay diagnostic capabilities. By 2004, bioMérieux was listed on the Paris Stock Exchange, although the family retained majority ownership through Institut Mérieux, the holding structure. That flotation was a careful piece of governance engineering that preserved family control at the holding level. Through all of this, the family had been experiencing profound losses. Jean Mérieux, a son of Charles and Alain's brother, died in a car accident. In 1996, Rodolphe Mérieux, Alain's second son, was killed when TWA Flight 800 exploded. He was 27. Christophe Mérieux, Alain's first son, who had trained as a physician and was deeply involved in the family's humanitarian activities, died unexpectedly at 38. These men were intended to be part of the next chapter of this enterprise, and their absence changed the family's succession calculus in concrete ways. The Fondation Christophe et Rodolphe Mérieux was established in their memory and now owns a 32% stake in the Mérieux Alliance holding company, meaning the family's philanthropic commitments are structurally embedded into the ownership architecture, not separate from it. The surviving third son, Alexander Mérieux, has carried forward the operational inheritance. He was named CEO of bioMérieux in 2014, the fourth generation of the family to hold executive authority over the core enterprise. His father Alain retained the chairmanship of Institut Mérieux, the holding company. This family, from a governance and cultural standpoint, has several noble qualities. The Mérieux family has consistently prioritized operational involvement. Unlike many business dynasties that gradually transition from operators to symbolic stewards, the Mérieux family has kept a family member in an executive role at bioMérieux for 4 successive generations. Their children are deeply trained in science and medicine. The expectation appears to be that heirs inherit both capital and scientific vocabulary. The family is also notably private. Their profiles in the press are thin relative to their net worth, which Forbes estimates to be about $7 billion as of May 2026. Today, Institut Mérieux sits at the center of a holding structure split between direct family ownership and foundation ownership. Family members control 68% of Mérieux Alliance directly, with the remaining 32% held by the Fondation Christophe et Rodolphe Mérieux. That foundation stake means a portion of the family's wealth is permanently committed through their philanthropic foundation rather than private accumulation. Through this structure, the family retains majority control of bioMérieux, which operates in over 160 countries with revenue in the billions, while Transgene develops cancer immunotherapies and the food safety arm has grown into a broader nutrition and testing platform. The vaccine business that Marcel founded and Charles scaled is now entirely within Sanofi. The family now has no stake in it. Whether the decision to exit was the right one remains debatable. The vaccine industry has been enormously profitable. But Alain Mérieux made an understandable call at a specific historical moment. Rhône Poulenc's capital was more important than family control, and retaining a minority stake in a company being consolidated by French industrial giants was less attractive than pivoting to a diagnostics business where the family could maintain majority ownership and operational leadership. Stepping back, what does the Mérieux story actually teach about long-term dynasty building? A few things stand out. The first is the power of scientific legitimacy as a competitive moat. From Marcel's association with Pasteur to Charles's work on mass vaccination, the family has consistently operated at the frontier of applied biological science, which keeps the enterprise relevant as the science moves forward. The second is the structural decision to embed philanthropy into ownership rather than separating it. The 32% stake held by the Christophe and Rodolphe Mérieux Foundation is part of the capital structure, and it creates a diversified institutional initiative for the company to lead a public health mission alongside its commercial one. The third is succession consistency. 4 generations of family CEOs or executives in a global science-intensive business is rare. It requires both a cultural expectation that heirs will engage seriously with the work and a structural willingness to invest in that preparation over decades. The vulnerabilities are also visible. A family's exit from vaccines looks different in hindsight than it did in the early 1990s, and the cascading personal tragedies clearly disrupted succession plans. The company has also faced the classic family business tension of balancing public shareholders with the family's long-term institutional perspective. Despite the vulnerabilities, a laboratory founded in Lyon in 1897 is still, more than a century later, a family-controlled enterprise at the center of global diagnostics. The empire has changed shape at every generation. Products, partners, and even the industries have all shifted, but the institutional core, the scientific identity, and the family's control has held the test of time.